get you to read some questions.
Oh yeah. When are opiates appropriate?
Just hold that up to your chest.
Can someone stop opioids and still manage their pain?
How can dependency on opioids be avoided?
I'll give you to read a couple of questions.
Okay. How should opioids be ceased? An opioid medication, how it works is it blocks the message of pain getting to your brain. So it doesn't take away the pain, it doesn't fix the tissue injury.
We know that opioids are really effective in the short term and for acute pain. Where the question marks are is really around the long-term use of them for chronic pain, where it seems like there's really diminishing returns.
The use of opiates in chronic non-cancer pain is pretty questionable. There is more and more evidence that people simply get side effects, dependency and addiction, and very little in terms of relief of pain or improvement in their quality of life. The most significant side effects of opioids are cognitive effects, so fatigue, trouble with your memory, feeling like you don't want to talk to other people, bowel problems, hormonal, where you don't have enough testosterone and your bones become quite brittle, as well as ankle swelling, making it difficult to wear shoes.
Opioids can interfere with the respiratory centres in your brain and stop your breathing.
Some of the limitations of opioids are that people develop tolerance. So that means that your body gets used to those opioids and you either need to have a higher dose to get the same effect, or your regular dose just doesn't have enough of an effect anymore. That can be a bit of a vicious cycle because you end up continually increasing the dose to try and have the same effect. And as you increase the dose, you increase the risk of side effects. And we do see for some people who develop dependence or addiction that often opioids become used in ways that can be dangerous for a person. And those benefits really don't outweigh the harms in those circumstances.
We in Australia and around the world have people who are dying because of their opioid use.
So some of the key changes from the TGA reforms I think are about introducing more multidisciplinary care, restricting the amount of medication that's out there, particularly for acute pain.
It's really important to have regular reviews to make sure that you're having the best possible outcomes and not actually having side effects or problems as a result of the treatment.
PBS changes I think are really important to get a review by another practitioner to make sure you're on the same page. They need regular review to make sure it's the right thing, side effects, all those types of things. So these changes have happened to increase safety around use of these medications.
I think for me, avoiding them, first of all, it's that serious discussion about, are these appropriate?
Appropriate prescribing of opiates means prescribing them and then planning on deprescribing them. Giving them when they're needed and planning on taking them away so they're not misused or are used inappropriately. I would say that the best times to take opioids are within the first 6 weeks of an injury or a severe illness. After 6 weeks, you would have to start considering tapering it down, and if you're taking it beyond 12 weeks, that's completely inappropriate.
Stopping taking opioids can be really challenging.
I reckon, and this is from my clinical experience, that the best way to assist people to start to cut down, to taper and to cease their medications, doing it collaboratively, together, over time, frequent reviews, lots of support, helping them to look at the other supports they might need to put in place once they start cutting their dose down. Increasingly, we're finding that people do better when they stop their opioids.
So we know that most people, when they stop opioids, their pain will actually improve, and if it doesn't improve, it won't be any worse.
So for many of my patients, no opioids are the way to go. For others, it might be a small dose, and particularly a small dose if and when they know or find that their pain is more severe.
They're not feeling sedated, they're not feeling constipated, they don't feel like a zombie all the time, so they can get some more functionality back.